So I'm giving a talk here at ASH 2019 based on the combination of Carfilzomib, Lenalidomide, Dexamethasone and Daratumumab, also referred to as KRd-D Daratumumab. This is a combination that has been developed in a previous phase 1 study at a prior ASCO meeting. They ran into a lot of problems with this because they had given too high doses of the drugs. So we have worked on this and improved the outcomes based on a revised dosing schedule. So we have treated 41 patients in a phase 2 study. So this is the first phase 2 study focusing on MRD and of course also safety in this new dosing. And what we see is that we reached the target of almost 80% MRD negativity after 8 cycles. And the toxicity profile is excellent. So with a 56 milligram per meter square once a week, we don't see any difference in toxicity profile compared to what we have seen with a standard of care KRd regimen that is supported by the NCCN guideline. We also have done sub-analysis on patients by age. We see that patients that are diagnosed above the age of 65, they have the same great MRD negativity. Obviously the numbers are small in a single arm phase 2 study. The total number of patients is 41. Also the follow-up is less than a year. I should emphasize that the proportion of patients in the study that are high risk is more than 60%. So it's higher than you normally would see, and still you see these spectacular MRD rates. So we are quite excited about these results. Because the results from this phase 2 study are strikingly strong, with 80% MRD negativity, we have already started working on a large randomized multicenter study to further evaluate this weekly KRd Daratumumab regimen. So we are going to have the KRd Daratumumab weekly as the experimental arm, and the standard of care wKRd-D will be in the control arm, and there will also be a second control arm, which is the weekly KRd regimen. This study will have MRD as the primary endpoint. We hope to enroll the first patient before the end of 2019.